Hello, Medicare Advantage risk adjustment operators, innovators, and learners. Welcome to another learning series of the Hughes Academy Risk Adjustment Made Easy, the Medicare Advantage kind. If today is your first time joining us, we want to say thank you for joining us and welcome. If you have been a learner with us, we also want to say thank you for joining us today as we continue on our series we started last week and we are going over throughout this month. If you have not subscribed to our channel, I would encourage you to subscribe, to like, to share, because it helps you not to miss anything from us, and it also helps us to reach a wider audience. I am your host tutor, Dr. Prince Baawuah. Last week, we started on the Medicare Advantage dental encounter data records made easy. And because of some recent updates that CMS have shared regarding Medicare Advantage encounter data dental, specifically, we want to take this month to review the past guidance and also what is upcoming so that you are in the loop of things. Last week, we looked at some of the prior guidance that led to CMS collection since 2024, and we are picking up from there. So if today is your first time joining us, I will encourage you to watch that prior video because today's is going to build up from there. Today we are looking at where CMS breaks from the X12 standard within the Medicare Advantage encounter data context. So that is what we are looking at today. Two standards, one system. The X12 837D TR3 is the industry standard for dental claim submission, like all the others, with the 837P for professional, 830 for professional and DME, and 837I for institutional records. CMS built its dental encounter data records and all the encounter data records requirements on top of that standard. But CMS does not follow the T3 exactly. So it's good to know where CMS breaks off in two specific places. CMS requires something stricter, and plans following only the TR3 or even your vendors that are only following the TR3 may be submitting the data incorrectly. So knowing that is critically important to be able to submit correct encounter data dental records to CMS on the part C side. The change number one, and these are recorded in the January 16, 2025 HPMS memo. And the change number one is the tooth information segment. The X12 837D TR3 has up to 32 repeating TOO segments per service line, but CMS is requiring health plans to have exactly one TOO segment per service line and no more. And if there are multiple service lines, CMS requires that each of them have a separate service line. Each of them has a separate service line. And that is something that is the first break from the regular TR3 X12 standard. So if there are multiple tooth, it needs to be on multiple lines because that is what CMS says will be efficient in processing Medicare Advantage encounter data as part of their main encounter data process. So what does this mean for your submission? Example, if you work on teeth 13, 14, 15, a dentist work on these 13, 14, 19 in one visit. Between the dentist and your health plan in processing, you may do the regular 837 things, but between the health plan and CMS, then that needs to be transformed into CMS's requirements. With this is the X12 TR3, one service line with TOO segments are acceptable. So this may be between your dentist and the health plan, depending on the requirements you both have among yourselves. But between the plan and CMS requirement is three separate service lines. Three separate service lines that are required. Otherwise, that will be rejected with an error. So ask your dental vendor or even yourself if you are submitting, are you billing to X12 TR3 or are you billing to CMS encounter data? And then between you and CMS, the health plan and CMS in submitting this, you want to make sure you are aligning with CMS's requirement for the dental submissions. The change number two, the header service date is required. In the X12 837D TR3, the header service date is situationally required. So it may apply or may not apply. But on the Medicare Advantage encounter data, this is required on the 837D, no exceptions. So you want to make sure that The header dates are required and they are on. If it's spanning between periods, you want to make sure your lines are aligning with the header for the submission. Otherwise, you'll have mismatches and the data may be rejected. And that is another area that you want to ask your vendors. If you have a vendor that is submitting on your behalf, or even if you are submitting by yourself, you want to make sure that you are transforming the data between you and CMS, between the provider and you may be different. You may be following the regular X12, but between you and CMS and their Medicare Advantage and counter data submissions, these are some changes that you want to critically pay attention to so that data is not rejected haphazardly. When the header date spans multiple, and I touched on this briefly, if the header service date covers the date span, every service line must carry its own date detail. Option 1 service line and a header, and option 2 treatment on a completion date. So at least one required per service line, and then the header will span that multiple line. So that is one key thing that you want to pay attention to. And the deadline for this was a prior memo you can see from here. This was 2025 memo, but CMS was looking forward and said both changes required before the start of Q3 2025, which is passed. And the purpose is to enable phase 2 back and edits, which CMS is starting. Then phase 2 will be live in May 21st. So it's just coming. And these are critically important as you look back and look forward so that all data gets to CMS successfully. Otherwise, this is what we want to cover for today. If you are not on our email list, I will encourage you to go to our website, www.thehealsacademy.com, and you can get our free signature gift from Chaos to Clarity, the essential comparison cheat sheet on Medicare Advantage risk adjustment data sources for you for free. And you get a chance to be on our email list so that you don't miss anything from us. And then you get your free signature gift as well. Otherwise, I will leave you for the day and we'll pick up next week as we now catch up and look forward to what CMS has in store for us. Thank you for joining us. If you have not subscribed, I will encourage you to subscribe, to share with others, with your colleagues, because these are critically important in this space. I'll catch you same time next week as we move on to the next topic in this series. Thank you and bye for now.